Hello, welcome to my channel. Today we will discuss about this topic. What is lupus? Lupus, often called systemic lupus erythematosus, is a chronic autoimmune disease. Autoimmune diseases cause the immune system to mistakenly attack healthy body tissue. In lupus, the immune system mistakes healthy tissues for germs, viruses, and other invaders. The system creates auto-antibodies, which actually attack the body's own organs. This attack can affect many parts of the body. Often, it results in symptoms such as pain, inflammation, fatigue, and rashes, and others. Lupus can affect the joints, organs, eyes, and skin. It goes through periods when it's more active, commonly known as flares or flare-ups. It also goes through times of remission, which are periods of decreased activity. Identify the 9 early signs of lupus. Although there's no cure for lupus, medications can treat its symptoms. Lupus symptoms and severity can vary from person to person. It's important to work with your doctor on a medication plan that's right for you. See a complete list of the medications and medication types that can treat your lupus symptoms. Corticosteroids. Corticosteroids, also known as glucocorticoids or steroids, can be helpful in treating symptoms of lupus. Steroids work by mimicking the effects of cortisol. Cortisol is a hormone that helps fight inflammation and regulate the immune system. Because steroids usually act quickly, your doctor may recommend a short steroid regimen until longer-term medications have enough time to become effective. Types of corticosteroids include prednisone, cortisone, hydrocortisone. While generally considered to be effective, steroids have many side effects. Possible side effects include weight gain, fluid retention, acne, irritability, trouble sleeping, risk of infection, osteoporosis, fragile bones. Doctors usually try to prescribe the lowest possible dose for the shortest length of time. Steroids can be taken as an oral pill or liquid. They can also be given as an injection into a joint, muscle, or vein. It's important to taper off of steroids slowly under the direction of a doctor. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are commonly used to treat the pain, inflammation, and stiffness associated with lupus. Over-the-counter NSAIDs include ibuprofen, Motrin, and naproxen. Prescription versions include indomethacin, Indocin, Nemetone, Relefin, Clecoxib, Celebrex. The most common side effects of NSAIDs are stomach irritation and gastrointestinal complications. Anti-inflammatories. Anti-inflammatories include aspirin and acetaminophen, Tylenol. Available over the counter, both can control pain and reduce fevers. Disease-modifying antirheumatic drugs, DMARDs. Disease-modifying antirheumatic drugs are a group of drugs used to treat certain autoimmune diseases. There are many types of DMARDs. They work by suppressing an overactive immune system and the resulting inflammation. DMARDs often are used in conjunction with non-steroidal anti-inflammatory drugs, NSAIDs. Types used to treat lupus include hydroxychloroquine, Plaquenil. Originally used to treat malaria, this drug was found to help arthritis and lupus. Cyclosporine, Gangrif, Nerol, Sendimune, Azathioprine, Ezicin, Imuran. Antimalarials. Antimalarial drugs decrease auto-antibody production, reducing the damage lupus can do to organs. Antimalarials can take several months to become effective. Although side effects from antimalarials are usually mild, they can cause vision changes in some people, so it is important to have regular vision checks. According to the Lupus Foundation of America, the 2 types most commonly prescribed for lupus are chloroquine, Arylin, and hydroxychloroquine, Plaquenil, bispecific inhibitors or monoclonal antibodies, MEBs. Belimumab, Benlysta, has been shown to suppress auto-antibodies in people with lupus. It was approved in 2011 as the first drug created specifically for lupus in 50 years. Though it has shown to be helpful, further research is needed to determine its long-term effectiveness. Immunosuppressive agents/immune modulators. In advanced cases of lupus, these drugs might be used to suppress the overactive immune system. Immunosuppressives may be used when other medications have failed to control lupus symptoms. Types include azathioprine, Imuran, methotrexate, Rumotrix, ciclophosphamide, Cedixin. These medications are known to cause potentially severe side effects, including liver damage, increased risk of infection, increased risk of certain types of cancer, sterility, sun sensitivity, hair loss. Because each of these medications has unique side effects, it's important to be closely monitored by your doctor while taking them. Anticoagulants. People with lupus have an increased risk of blood clots. If your doctor determines that you need preventive treatment, they may prescribe an anticoagulant medication to thin your blood. Anticoagulants include low-dose aspirin, heparin, calciparin, licamin. Warfarin, Caromartin. If you are prescribed an anticoagulant, your doctor will monitor you regularly to make sure your blood doesn't become too thin. Complementary medicine. Complementary medicine can be of assistance for both managing the symptoms of lupus and bolstering the immune system. The word alternative might sound strange or even exotic to some, but you may be surprised to learn that many of these alternative treatment options and therapies are more familiar than you think. Alternative therapies can be of benefit and are often used in conjunction with traditional medications. A better term than alternative is perhaps complementary, since these therapies are typically used as a complement to traditional pharmaceuticals. It is very important to discuss these options with your doctor before initiating any treatment or complementary therapy on your own, as they may interfere or adversely react with your conventional medications. Complementary and alternative supplements and treatments for lupus. Flaxseed. Flaxseed contains a fatty acid called alpha-linolenic acid, which may decrease inflammation in the body. Some studies have found that kidney function may improve in lupus patients who had kidney problems, such as lupus nephritis. Abdominal pain and bloating can be side effects of taking flaxseed. Fish oil. Fish oil supplements that contain the omega-3 fatty acid may be beneficial for people with lupus. Preliminary studies have shown some promise, but more study is still needed. Nausea, belching, and a fish taste in the mouth are some side effects you may experience while taking fish oil supplements. Read more about this topic in our blog, The Lupus and Diet Dilemma. Vitamin A. Vitamin A is an antioxidant and is commonly found in whole milk, liver, and some fortified foods. Beta-carotene is a provitamin found in carrots and many colorful vegetables that are then converted to vitamin A in the body. Vitamin A protects against free radicals, harmful substances in your body, which can damage DNA and lead to cancer and other diseases, and has anti-inflammatory effects. A lack of enough vitamin A has been linked to inflammation in the intestines, lungs, and skin. For some people, taking vitamin A supplements could reduce the inflammation that contributes to conditions like inflammatory bowel disease, acne, and lung disease. Vitamin D. People with lupus have shown some benefits from taking vitamin D supplements. In recent testing, high doses of vitamin D were safe and appear to temper some of the destructive immune system responses believed to cause lupus. Research is pointing to an immune-regulating role for vitamin D. Vitamin E. This vitamin supplement comes in several different forms. The alpha-tocopherol type of vitamin E may help prevent heart disease by slowing the release of inflammatory substances that damage the heart. Alpha-tocopherol also might be effective for easing lung inflammation related to allergies. However, because studies were conducted on animals, it's not yet clear whether the results will translate to humans. Evening primrose oil. Used to treat inflammation, evening primrose oil is associated with alleviating rheumatoid arthritis. Alternative lupus therapies. Diet. Some of the most important issues that specifically relate to lupus patients in regard to diet and nutrition are reduction of inflammation and swelling, prevention of nutrient deficiencies, maintaining strong bones and muscles, combating medication side effects, reaching or maintaining a desired body weight, and reducing the risk of heart disease. Read more about some anti-inflammatory diets in our blog, The Paleo and Anti-Inflammatory Diets. What you should know. Massage. Massage can be beneficial and therapeutic to those with chronic joint and muscle pain due to lupus. Massage can improve circulation and help relieve joint stiffness. However, if you have cutaneous lupus, or lupus primarily affecting the skin, then you may want to avoid intense massage that can lead to bruising or even bleeding underneath the skin. Be sure to use a licensed massage therapist and, if possible, one familiar with lupus if you decide to try professional massage as part of your lupus treatment and management. Chiropractic. Chiropractic care is the manipulation of your spine and other connective tissue to improve the mobility of joints and reduce pain. Practitioners are required to go through extensive training and licensing exams, and chiropractic care is often covered by insurance. The effectiveness of chiropractic therapy for lupus remains controversial, although many have found relief with this type of therapy. Acupuncture. Data suggests that acupuncture may help in treating lupus symptoms, although evidence is limited. Studies have shown that acupuncture may be useful in alleviating pain associated with lupus. Yoga. The ancient practice of yoga can help people with lupus maintain limber joints and help alleviate stress. Stress is the enemy of lupus sufferers, as it can increase inflammation and therefore increase pain. Before starting a class, talk to the instructor about any special restrictions you may have because of your joint symptoms. Meditation. Also an ancient practice, meditation makes use of the mind's ability to control the body and can be used in lupus treatment to control pain, reduce stress, and improve your sense of well-being. Some additional alternative therapies can include Herbal medicine, feverfew, goldensil, and patadarso are just a few of the helpful herbs one can use. Please consult your physician before adding any of these supplements, as they may interfere with your other medications or have unwanted effects. Echinacea should be avoided as it is primarily used to boost the immune system. In lupus patients, the immune system is overactive and taking this supplement could cause flares in disease activity. Hydrotherapy, cold or hot compresses, can be used for pain relief, mind/body medicine, creative visualization, spirituality, relaxation techniques, biofeedback, and other mind/body treatments can strengthen the immune system, as well as reduce joint pain and easy accompanying depression. Traditional Chinese medicine treatment may involve acupuncture, herbal therapy, dietary alterations, and exercise. Complementary. Alternative lupus treatment. Precautions. Lupus patients should always consult their physician before using any complementary or alternative therapies, especially herbs and supplements, as there's limited evidence available on their benefits and side effects. As mentioned before, some of these have the potential to react negatively with drugs or cause other toxicity problems. By working closely with your medical provider, and being upfront about any complementary therapies you want to explore, together you and your medical provider can formulate a plan. In addition, let your medical provider know about any supplements you are currently taking in order to avoid preventing the efficacy of any prescribed medications. We hope this blog has been able to help you on your journey of lupus management and direct you to some options you may not have considered.